For the bottom line on all this, let's go now to Chief Washington Correspondent George Stephanopoulos. George, good morning to you.
Hey, Diane.
Give me a sense of what's really going to happen this year on health care. We know it begins today with this meeting. What can they really accomplish this year?
Well, I think there's a very good chance, probably the best chance we've had in 15 or 16 years to actually get a comprehensive health care plan through. But, Diane, on this announcement here, the details are still sketchy. There's no guarantee that there's going to be follow-through, and it will take real changes in the law to get the full savings. But the fact that this group, from the health insurance companies, the health care providers, the doctors have said they'd rather switch than fight is a huge difference. It increases the chances that health care is going to get done this year. It also significantly may free up money so that to pay for expanding coverage for those who don't have insurance.
But let me talk about what we register at home this morning for our families. They are considering this plan in which there would be an incentive for doctors not to send you to that big army of specialists or the big army of tests. Are Americans going to accept that?
That's a very good question. Most Americans don't like the cost of their health care or their health insurance, but they are satisfied with the quality of the care. What the administration believes, and what some of these companies that are coming to the table believe, is that right now we pay too much for care that doesn't matter and too little on things that will really make a difference, like preventive care. One of the kinds of reforms they're talking about, for example, is if you go to the hospital for a heart bypass surgery or to deliver a baby, now they say you should just get one single bill for the entire stay, for the entire ailment. You shouldn't get charged for every single test, procedure, and that creates an incentive to pay too much for health care that we don't need.
Big debate coming up, but I have to ask you as well this morning about former Vice President Dick Cheney, George, because in my memory, I don't remember a predecessor going after the current administration. Extraordinary. Not only accusing the Obama administration again of making America less safe, but yesterday he took out, or seemed to, after General Colin Powell.
Well, if I had to choose in terms of being a Republican, I'd go with Rush Limbaugh, I think. My take on it was Colin had already left the party. I didn't know he was still a Republican. I just noted he endorsed the Democratic candidate for president this time, Barack Obama. I assume that that's some indication of his loyalty.
Boy, he is not being shy at all, Diane. The Vice President says he thinks this is duty to speak out right now, and he says that a lot of the changes that President Obama has made in counterterrorism policy and closing down Guantanamo, saying he will, doing away with these enhanced interrogation techniques, he says that's going to make America less safe, so he has a duty to speak out. But a lot of Republicans are wondering why one of their least popular leaders is out there up front so often when they should be looking to the future.